Welcome to ears, nose, mouth, and throat assessment. So first is preparatory phase. Prepare the equipment needed to minimize time and to be organized. So first is tongue depressor. So tongue depressor is an equipment used for checking the inner and buccal mucosa. So the next one is this lighter, assuming that this lighter is a pen light for illuminating. Next one is otoscope, assuming that this highlighter is otoscope to check for the ear of the patient, especially the tragus part. The next one is the tuning fork to test for the hearing of the patient. And the last one is the gloves for hygiene purposes and to promote infection control. So the next procedure is to identify the patient and explain to them the procedure and purposes. So, hello ma'am, good afternoon. My name is Sam Padi, your nurse for today. Are you Miss Garcia, ma'am?
Yes.
Okay, ma'am. So today I will be doing the ears, nose, mouth, and throat assessment.
Okay.
So the next procedure is to wash your hands and observe infection control. So the first assessment is the ear assessment. So for the ear assessment, the first procedure is you need to instruct the patient to sit, and the next one is to use your dominant hand to occlude the tragus part of the patient and position yourself on the opposite side to assess for the gross hearing of the patient. And the next one is to cover your mouth as a nurse and say a word with at least 3 syllables and instruct the patient to repeat the words to prevent from the patient to lip reading through her peripheral vision. So, okay ma'am, please repeat the words as I say. Elephant.
Elephant.
Okay. Hospital.
Hospital.
Okay, very good. So the next procedure for the ear assessment is the Weber test. So for the Weber test, you are gonna use tuning fork. So you are gonna tap the tuning fork at your palm and then place it above the head of the patient. So, and ask the client to where the location is heard. Okay, ma'am? Kanang igna ko ma'am kung asa siya na dungganin mo, it's either sa left or sa right or sa both drop. Okay.
So both.
Okay, both. So, a normal Weber test has a patient reporting that the sound is heard equally. If an affected patient, if she or he has a defective ears, when the tuning fork is louder, the finding indicates a conductive hearing loss and defective in the ear. So after the Weber test is the Ryan test, also by using the tuning fork. So the Ryan test is you need to position yourself at the other side of the patient, and the next one is by tapping the tuning fork and place it on the mastoid process. Okay ma'am, igna lang ko ma'am kung kano saan mo madungkan ang kuan. Ingon, let's stop. Kano saan mo madungkan.
Stop.
Okay, kani ma'am.
Yes.
Okay. For the last assessment, for the ear assessment, is you need to palpate the ear for tenderness. For the inspection of the ear, you need to lift the patient's ear upwards and downwards. And the next one is by using the otoscope, you need to put the otoscope inwardly and check for the canal cerament, swelling, redness, and other any foreign body or lesions to check for the tympanic membrane and external auditory canal. So the next procedure is nose assessment. So for the first procedure of nose assessment is you need to tilt the patient's head, and by using your dominant hand, hold the light and hold the head of the patient. So next is observe the nares, lining of the nares. Observe for the presence of any lesions or any redness, swelling, and growth and discharges. Okay, ma'am, check na to yung nose. So, okay, wala ka. So, the mucosa is usually pink with clear watery discharges. So next one is you need to inspect for the position of the nasal septum between the nasal chambers in particular. The nasal septum is usually intact and in the midline. Okay, ma'am, check na to yung nasal septums. Okay, so her nasal septum is in the midline. And the next one is for inspect for the mucous membranes and for the permanent drainage for the nasal polyps. So as I have observed lately, so wala siya ka ng mga polyps or any lesions or mga burot-burot sa ilong. So next one is palpating the maxillary and the frontal nose sinuses. So, okay. Frontal sinuses, maxillary. Sakit, ma'am? Sakit? Okay. So normally sinuses are not tender. So since dili ra sakit iyang sinuses, so wala ra siya kanang sinusitis. So for the last assessment, which is the mouth and throat assessment. So for this assessment, the first procedure is to check for the lips. So by observing the lips, inspect for the symmetry of contour, color, texture, and moist. So lips are usually soft, moist, and smooth in texture. So as I have observed, her lips are normal. There are no lesions or any polyps, and the texture is also fine. So the last assessment for the mouth and throat assessment is for checking for the inner and buccal mucosa. For this is you need to use a tongue depressor to pull for the lips and the cheeks. For proper visualization, also you need to use a pen light. So okay, ma'am, can I check mo na ito ang mouth? So for checking the mouth and the cheeks, you need to check for the color, position, or check if there are lesions, checking for the bleedings of the gums, and checking for the dental fillings of the teeth, and also say ma'am, okay. So checking for the tongue, it is in the midline, so that is normal, and the color of her tongue is pink, and that is normal. For checking the texture of her tongue, it is slightly rough. It is because of the texture of the normal tongue. So for the next one is extending the uvula and the palates. Okay, ma'am. Backwards lang. Check natin yung mga tonsils. Okay. The uvula and the tonsils have no any presence of bony prominences. There are no lesions. There are no polyps. All of her kanang inside the mouth is normal. There are no abrasions or any such as kanang mga ulcer or kanang mga sakit or mga abnormal findings about sa mouth. So the tonsils are oval-shaped lymphoid tissues situated on the either side of the posterior and anterior tonsillar pillars. The soft tissue supports the soft palate. So as I have observed by inspecting her mouth inside lately, everything is normal. Nothing. I have seen no abnormal findings, and that's all. Thank you.